Well, hello and welcome to all of our Gold viewers. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, welcome to everybody joining us here today. I'm so delighted to have Valentine Forston back with us here at Gold Learning. And we're going to be talking about Amber and everything that she's doing right now in just a moment here. But I do want to tell you a little bit about our Gold Neonatal Conference, which is coming up right around the corner here. And Amber is actually going to be speaking as part of the conference in a very specialized package titled Advancing Human Milk and Breastfeeding Practices in the NICU. Now, this is a great package for those of you who are focused in that area or really want to advance their skills in this particular area. And there's always these amazing advancements that happen, and we're learning so much all the time about specifically the correlation with using human milk and breastfeeding practices in the NICU, right? And we're always trying to find good practice, better practice, and how it really complements care and supports, of course, the overall family and getting them discharged, right? We talk a lot about that, of course, in the field of NICU. Well, Amber is here, and she's going to be talking about breastfeeding medically complex infants in the neonatal ICU, which is another big challenging topic. I feel like it's a huge topic that Amber will be touching on. But for now, I'd love to have Amber come online here and introduce yourself once again, Amber, and tell us what you've been up to since we last spoke to you here at Gold.
Hi, everybody. Like she said, I'm Amber. I live in Lexington, Kentucky, and I am currently working in Baptist Health Lexington. I work in a level 3 NICU and also cover mother baby and our outpatient feeding and swallowing clinic. So I went from seeing 30% pediatric patients and 70% adults a few years ago to seeing 95% pediatric patients, and every once in a while I go see an adult, just to keep my skills up. So and I spend loads and loads of my time in the NICU for the most part. That's probably where I spend most of my time, but I also spend a lot of time supporting our lactation department because they're overworked and understaffed, just like everybody else. So we work very, very closely together to try to help, support our families as much as possible. Working on developing some new committees in our NICU to help provide more parent autonomy. So we're looking at developing a system to help parents support environment of care and helping them control babies, like doing more parent transitionings from isolates and open cribs, and helping parents do like rocking their babies, simple things that give parents more involvement in their care, because the NICU is so challenging for families and they feel left out. So that's something I've been very excited about to kind of help develop that. So we're working really closely with our physical therapists and our physicians and our nursing staff to develop that. So pretty exciting.
I love that. Yeah, I love that. That autonomy for parents is so important. And you're right. The simplest of things can make sometimes the biggest differences all around in the collaborative care, working with parents, and coming from the perspective as a parent myself. And I had really good experiences, albeit very challenging, in the NICU. I was well set up, so I was very fortunate, but I know that things are still evolving for so many of us. And you're working hard with your staff, right? You're getting the buy-in from your staff, and because practice, it can be very challenging in the NICU as well. So that's wonderful. Hey, I've got this question for you. You mentioned that you're now, how many percent of clients are pediatric now? You have how many?
Probably like 95%. I mean, I see like 1 to 2 adults a week, maybe.
Right. Yeah. How did this all happen? And did you imagine that you would be doing this? To me, it's phenomenal, but very cool. I'm glad that you're in that position. Yeah. Tell me.
Yeah. I mean, it was obviously my goal was always to do more pediatrics, but it was never in a position just where I live personally, where there were lots of therapists in the NICU, or really even our lactation support wasn't huge in our NICU. And so
Sure.
for me, it's just kind of like slowly over time. And I'll be honest with you, is when I switched to doing more lactation work for our
Right.
NICU that really got my foot in the door. So now for our NICU very specifically, they kind of have me covering lactation in the NICU, which is great for me because that's all I want to do all day anyway, is work with breastfeeding babies. So it kind of just like slowly chipped away, over the last several years. And then when COVID started, they actually really just wanted a primary person to be there. They didn't want somebody who was kind of spread out everywhere. So it kind of really like all convalesced all at one time, where they kept me primarily in the NICU after that. So
oh, that's
blessing.
fantastic. Yeah, no, that's really super cool. And because I feel like, since we have brought in more collaborative care, and the fact that you represent, speech language pathology, and as an IBCLC, like your skill set is just phenomenal, and I think that this is where we're getting almost better traction. Is that the right terminology to say that, we're moving forward, we're getting more professionals involved and engaged in actually breastfeeding, the specifics and the support, the counseling factors that play such a significant role to really stabilize and recognize that although it's weird to say, I always say this is weird to say, that the field of breastfeeding medicine is still a new one in sorts, even though we've been breastfeeding forever, but the field of medicine itself is still very new. And the fact that we're, still in the sort of advocacy stage of that is unique. But having people like yourself, especially in such a specialized area, I think is just phenomenal. So anyways, I know I'm preaching to the choir and saying that, but the fact that you love it, and that, obviously you're at 95% of your patients now are there is just wonderful. Now, you specializing in the NICU, is this another area that you always saw yourself, going to? Like, was it always a place that you thought you were going to land? Because not all speech language, IBCLCs are in the NICU, right? There are different areas. Yeah.
Yeah, it's definitely something that I had hoped for, but I knew 7 or 8 years ago in the facility that I was working, that just was not going to happen. It just was, I called it the fortress of solitude. And it really was very confined to probably not great neurodevelopmental care. The NICU across the board, the NICU has obviously evolved through the years, and stuff like that. But then when I had moved to Florida and started really working in the NICU all the time, and then came back, we actually got a new director in our NICU. And so that has made all the difference really in the world for us. Our director had actually worked with speech pathology in another facility and kind of saw everything that everybody could bring to the table as a team. And so she's really kind of been the driving force behind having physical therapy and speech pathology and the dietitians available and everybody there permanently, not just we're just this consultative service. And it's helped me develop kind of a relationship, a rapport with the staff where now they do respect my opinion. And for me, that was like the biggest professional kudos, because now they're like, oh no, we want you up here helping breastfeeding moms. We want you up here helping them, learn all these things. So that was the biggest thing for me, was having a support system. That's what made all the difference. And that's what I tell students who are coming in, out of the field of speech pathology. One, I always encourage them to go to a lactation course, even if it's just a CLC course. You need some kind of foundational guidelines.
Totally.
Yeah. Oh, absolutely. You don't need to be working in that type of setting without a foundation.
Yeah.
Bad information spreads like wildfire,
Sure. Oh yeah, for sure. Yeah.
So having that support system is it's made the biggest impact on my professional career. So
I love hearing that story. I mean, honestly, because you sort of started out thinking that it might never happen. And here you are. You never know who is going to walk into your life or the lives of others that's really going to have that focus and then have the ability to elevate people around you. So that's good leadership right there, right? That is awesome.
Right.
Yeah, I love hearing those stories because sometimes we do think, I still think about those things myself. It's never going to happen in my, neighborhood or my city or whatever, but you just don't know. You just got to keep your eyes and ears open all the time and keep having those conversations. And we've talked a lot this year, in the field of lactation about collaborative care. And you're kind of the epitome of that, and you're talking about it's happening. So I think maybe it's getting contagious. Maybe people are seeing the results. We've known for a long time, Amber, that, if we have good success with using human milk in the NICU and breastfeeding, that the research shows us the stability of these little ones, right? So that is something that is good, solid research in our midst, correct?
Absolutely. And that's
Yeah.
what, if we have more information out there that shows what using donor milk or Prolacta or other human milk products can do for
Right.
mom's morale when they're trying to establish a milk supply for those babies. To me, that's been the biggest cornerstone for success for us, is starting to use human milk products for breastfeeding babies.
Right. Yeah. To move things forward. That's fabulous. All right. Let's talk quickly about your actual topic, which again, I know everyone's going to love this because it really is, it's some of the nitty gritty pieces that really, for these complex infants can really make or break kind of situations and really move them forward. So the topic title is Breastfeeding Medically Complex Infants in the Neonatal ICU. Give us a little overview, a little snippet about what that's going to be about.
So I think the biggest thing, again, I'm a speech pathologist, so I do have a therapist heart. But for me, like looking at this topic in general, is we can talk about breastfeeding in the NICU or breastfeeding success in general. But for the NICU specifically, I wanted to start out with looking at what neurodevelopment looks like and why that's so important in the NICU, because I think we get so caught up on what success looks like and whether at the end of the day, it's just that mom's breastfeeding or not. And that's not really always what it looks like, because when they go home, it might look completely different than what they're going to look like when they're in the NICU, so trying to getting that foundational care down of what taking care of a medically fragile infant, whether they're preemie or have all these other comorbidities, what that looks like for practitioners and for parents, because it's not just about breastfeeding, it's about caring for your medically fragile baby. And with breastfeeding being such a bonus that you're getting out of this, so it's like trying to help them learn to care for those babies in the first place. And I think even as practitioners, that's one of the things that we struggle with, is understanding that they're still preemies or they're still sick term babies in the NICU. They're there for a reason. And I think even as a healthcare in general, if you think about, like you had mentioned, lactational medicine is such a immature field, but even the neonatal ICU is still such an immature field, and that people don't think of it as an ICU. Adult ICUs might only have an acuity of 2 patients per nurse, and then you go in the NICU and these nurses have 3 and 4 patients. Well, that's just not even appropriate, so just getting people to understand the foundational knowledge that you need to work with medically fragile babies to help build breastfeeding success is kind of, where I was coming from with it. So
that's awesome. Well, I mean, I know it's a fabulous topic. It's a big topic, right?
It's a big topic.
It's a big topic. But I think you really, I mean, I've had the inside scoop on this topic already, so I know you served it well, let me tell you. So that's awesome. But you said something very significant, and that is, we really have a hard time, how do you measure success? And I think going back to understanding development, and success is going to happen in layers and in different places and so forth and so on. And it's not one thing or the other. It's not breastfeeding or not. There's many, many things in between. And we need to be really cognizant of that as professionals so that when we're working with families, we're not setting them up to fail, and that's the reality, right? So knowing the foundation in going back and looking at development and, expectations and limitations of what we're working with, 2 steps forward, 3 steps back, those types of things. Right? Happens all the time. But you've done an excellent job in really laying out that foundation. So thank you so much for doing that. I know you folks listening in, you're going to love this topic. It is part of our add-on package that I don't think you're going to want to miss this year at all. Advancing Human Milk and Breastfeeding Practices in the NICU lecture pack as part of our neonatal conference. Amber, thank you so much. It's always great hearing what's happening in your world and just your excitement always about this topic. So thank you.
All right. Thanks so much for having me.
Absolutely. Absolutely. And for everyone listening in, don't forget, you can go to our website right now at goldneonatal.com. You can check out all of the program that we've got coming up for you, including, of course, with Amber, with our add-on package, Advancing Human Milk and Breastfeeding Practices. The conference is opening soon, so don't forget to register for this event to get in and all the savings. And we will look forward to seeing many of you online. Thank you so much for joining me here today, Amber, and to all of our viewers. Thank you for checking in. We'll talk to you all very soon. Bye-bye for now, everyone.